Group 1 presents Children with Cancer and Their Families, Psychological Issues by Sabela, Emily, Lana, Echi, and Lisa. According to the World Health Organization, around 400,000 children around the world develop cancer every year. The diagnosis and treatment of cancer not only impacts the lives of the children experiencing it, but also greatly impacts their families. A cancer diagnosis can cause a disturbance in family dynamics as well as intense emotional feelings of discouragement, sadness, anger, and fear. Parents struggle with knowing how much information to share with their children, coping with upsetting events throughout treatment, adjusting to an uncontrollable environment, and supporting their sick child. Mothers in particular experience psychological, existential, physical, and social issues as they are usually the more involved caregiver throughout diagnosis and treatment. These psychological issues require interventions in order to address and treat them. As a group, we explored various methods that nurses can use to assist with these issues that families face when a child is dealing with cancer. Sabela researched how virtual reality can help with children with cancer experiencing psychological issues. Lana explored how parents are specifically affected and whether time improves their issues. Echi examined different ways that parents can help share information with their children who have cancer. Lisa looked at how hope can help parents throughout the cancer process, and I, Emily, asked the clinical question of how effective psychotherapy can be in reducing psychological issues in mothers of children with cancer compared to no intervention during their child's treatment. Psychotherapy, which includes cognitive therapy, includes an assessment of life processes focusing on behavior modifications, thinking patterns, cognition, emotional response, and social functioning. While a child's cancer should be prioritized, the health and needs of parents also need to be considered. To answer this question, I used Sanal to find evidence-based research and entered keywords including psychotherapy, children with cancer, mother, and family. I found a research study by Latifi et al. Titled The Effect of Cognitive Emotional Intervention on Psychological Distress in Mothers of Children with Cancer. This presentation will dive into the clinical questions surrounding mothers of children with cancer and psychotherapy by sharing what the evidence-based research has found in Latifi et al.'s study, whether the research is relevant and appropriate, as well as how we, as nurses, can implement it into our practice.
Now to go over the population of the study and how the literature was conducted. The population comprised of 100 mothers of children with cancer who had been referred to the hospital for chemotherapy. The requirements for participation included participants of at least 20 years of age, having the ability to read, and having a child with cancer 12 years of age or younger who had received already 1 dose of chemotherapy treatment prior. Furthermore, criteria for the study also included a lack of any cognitive impairments, no history of psychological disorders, and no crises that had happened in the last 6 months aside from their child's cancer diagnosis. In terms of the method, the literature was conducted using a 2-part questionnaire to gather the research data. The first questionnaire was used to inquire details regarding the family dynamics and the child's diagnosis, and the second questionnaire was conducted using the Kessler Psychological Distress Scale, which is a tool used to monitor psychological interventions and treatments through the identification of depression and anxiety. Following the consent process, the participants were assigned at random to either a control group or an intervention group. The intervention group received 5 group sessions of cognitive behavioral therapy over the next 10 weeks and were then reassessed, while the control group received no therapies before the reassessment process. These variables were then compared to obtain the results.
I will critically appraise the article by Latifi et al. 2020 using the American Nurses Association framework. This study is peer-reviewed and was published in 2020, which is current. The article's title accurately describes the study. The abstract outlines all the segments tackled from the background to the conclusion. The introduction clearly illustrates the psychological impact of cancer on families, which is relevant to the research. There is no clearly defined research question, but the authors have outlined the statement of purpose in the objective section of the article. The authors did not use a theoretical framework approach in the report. The literature review is relevant to psychological issues affecting parents and their children with cancer. It explains why the population consists of mothers who have children diagnosed with cancer. This has helped ensure the analytical approach of the obtained data correlates with the research study. The authors have used a quantitative analysis approach to verify the survey under research in the method segment. The results from the research study was recorded and tabulated using tables. This has helped analyze and discuss the results obtained from the targeted population to validate the theory of the research project. The information is supported by evidence and the tone appears unbiased. However, the study's limitations include the exclusion of fathers from the study. In the concluding segment, the authors advise these mothers to seek psychological interventions since it helps improve life. After critically appraising this article, it is clear that the recommendations and results from the article can be used to help mothers of children with cancer promote quality health and care. Therefore, it is an acceptable and relevant source of information to investigate the clinical question.
So the results of the research are as follows. During the study, it was found that following the cognitive emotional interventions, the mean score of mother's psychological distress was significantly different between the intervention and control groups, and that there was a significant reduction in psychological distress. The research also discovered that spirituality and positive thinking can benefit a mother's psychological state. Parents experience many psychological issues such as stress, anxiety, and grief, in which were all relieved from the mother through cognitive therapy and encouragement of cognitive emotional interventions, in which facilitated deep cognitive processing. The study further found that by altering their distorted perceptions through cognitive therapy and helping mothers analyze and consider their negative thoughts, it was highly beneficial in reducing their stress and anxiety during this time. Reducing mothers' psychological distress as primary caregivers for their children who are diagnosed with cancer can help improve the level of their mental health and quality of life.
Cognitive and emotional interventions for parents of children with cancer can be implemented within nursing practice for those nurses who work in oncology or other specialties that involve parents who are psychologically impacted by their child's illness. According to the CNO, RNs and RPNs can perform the controlled act of psychotherapy without an order so long as they have the training, skills, experience, and judgment to apply it to their current practice. Allen 2020 suggests that nurses enroll in post-grad education to learn more about cognitive therapy techniques, although the guiding principles of psychotherapy can be easily used with patients to help with the psychological and physical issues without any specific training. Due to the evidence indicating the impact of cognitive therapy on patient health and wellness, it should be more commonly implemented with readily available techniques for all nurses. So in conclusion, cancer diagnosis affects both a child and a parent's psychological well-being. However, mothers as the primary caregivers are particularly impacted. The study by Latifi et al. 2020 helped answer the clinical question and also found out that psychotherapy, and specifically cognitive therapy, is effective in reducing psychological issues for mothers of children with cancer compared to no interventions at all during their child's treatment. These findings can and should be implemented within nursing practice through the use of psychotherapy techniques to reduce the psychological issues that the mothers of children with cancer experience. And this now concludes our presentation.